welcome to our training on the client meeting. This is going to be part one of a four-part series that we're going to offer on the way that we generally interact with our clients through that initial enrollment meeting that we may have. And an important disclaimer here at the beginning, this specific training series is designed with the intention that we're meeting in person. So this might look and feel a little bit different if you do most of your work online or by phone. And that's okay. This is just to get those new agents started and give you a general idea about the process of meeting with clients. Again, this will be part one of a four-part series. This is going to be about the steps that we take before the meeting actually happens. Session 2 and 3 will get into the things that we actually do in the meeting as far as evaluating and presenting plans using TLC's exclusive enrollment platform called Smart Enroll. And then part 4 will be some tips and recommendations for steps that we can take as agents after the meeting has concluded. With that, let's go ahead and dive in to the client meeting part 1, the things that we do as agents before the meeting. So one of the first things that we have to pay attention to as agents is the requirement for a scope of appointment form. Always secure a compliant scope of appointment form 48 hours prior to meeting with your clients. We recommend doing this at the point of scheduling that appointment with your client using Smart Enroll, which I'm going to demonstrate a little bit later on in this session. The scope of appointment can be sent by text or email. When we look inside Smart Enroll, there's a phone version that you can use. And there's even a PDF that you can download and have your client fill out if they're a walk-in or if maybe they're in your office and they're going to come back 48 hours later. We do highly recommend walking the client through the process of completing the form while on the phone with them, and we'll talk more about that when we get into the demonstration. Scope of appointment forms have to be maintained for 10 years plus the year of initial enrollment. The nice thing about Smart Enroll is those documents are automatically going to be maintained for you. So again, we have to go ahead and secure that scope of appointment form. What happens if you have a walk-in client? So you're in your office, if you're fortunate enough to have one, and a client just walks in off the street and wants to talk to you about Medicare. If it is a legitimate walk-in client, and there's some people who have asked, can I write up a client who I scheduled and I forgot to do a scope and they come to my office, is that technically a walk-in? That's not the intent of the rule. The intent of the rule is, again, someone comes into the office unannounced, unscheduled. You still have to complete a scope of appointment form. However, in that instance, the 48-hour rule does not apply. You do note on the scope of appointment form that the client was indeed a walk-in. Many of you that may be listening to this may be part of an existing agency. Maybe you have home and auto insurance and a book of business. If someone comes in to pay a bill for their auto policy and they mention Medicare or they see a flyer or sign about Medicare, you do not have to wait that 48-hour rule when they are a walk-in. So before the meeting, this is really important. You want to remind your client of the things that they're going to need when you have that meeting with them. This can help you save time. It can help keep your meetings on track and efficient. And so we just give these basic reminders. And this would be a good slide if you want to take a screenshot of it. And you can have this on your desk or on your computer as things that you tell your client to bring. Number one, if they have it, is their Medicare ID card. We need that in order to do a plan enrollment. We're going to need to know their Medicare ID number and their Part A and Part B effective dates. If they don't have it, we're going to get into that in a few moments. Also, we need medical provider names and addresses. And this can be important when you're doing a network search, sometimes on the carrier sites. One address for a provider will show up as being a network and another address will not show up. 9 times out of 10, it's a mistake in the network directory. So even though it's not on the slide, I also like to tell them before they come to meet with me, bring medical provider names, addresses, and the office phone number. That way, if we're in the meeting and we're looking in a network directory and we can't find that provider, we can simply say, let's call together and find out if they take this insurance. The third thing we need to have, and this might be the most important, is a prescription list, or my preference, the the actual pill bottles. If they prefer a list, we're going to need to know the full prescription name, the dosage or strength, and the frequency for each medication. The most important thing here is the full name. There are many medications that have different varieties, and that means the name has additional words after maybe the first word or two on the bottle or on the box. There are some medications that come in pill form, cream form, ointment form, and it all has similar naming. So we want to be really specific about either making a really detailed list or actually bringing the physical medications for us to look at. If you're in the meeting and they don't have a list and they didn't bring their medications, we do have a couple of avenues to support that client. Maybe they have a MyChart login and we can go see what their current medications are with them if they can log in. The one word of caution here is sometimes in MyChart, there's a lot of out of date medications that maybe they're not taking if they haven't been to the doctor in a year or two. We can also call their current pharmacy with them. And as long as they're on the phone, that pharmacy will give them their prescription list. So we have ways around this, but surely the best way for us to have efficient meetings and to be most helpful is for them to come prepared. Finally, a preferred pharmacy name and address. That's essential. We want to know where they like to get their medications filled, and that'll help us guide them and do good comparisons when we get into Smart Enroll here in a little bit. Important pre-enrollment agent procedures continuing here. We do want to verify Medicare eligibility. Now, if someone's turning 65, it's a pretty safe bet that we know that they're in that initial enrollment period and they're going to age in and they have the opportunity to sign up for Part A and B in a plan of their choice during that initial 7-month window. But it gets a little more complicated if they're under 65 and maybe they qualify under disability, or maybe they have certain illnesses like kidney failure. And we need to go ahead and make sure that we can confirm that eligibility. So there's a couple ways that we can do that, but most times what happens is the client will come to you and already have that A and B card if they're under 65, or they just got a letter stating that because of their disability, they will be eligible for Medicare effective on the 1st of March of 2026, for example. So sometimes we have to do a little next level research into their condition, especially if they're under 65. We also want to make sure to determine at the beginning, and we can even talk about this when we're scheduling, whether or not that client is on Medicaid. Are they chronically disabled? Do they get care through the VA predominantly? Or are they eligible for a special Medicare plan option through their employer or union? And that last piece, I think, is something that newer agents often forget about. We always want to ask that, do you have any retirement health care options, healthcare plan options through your employer or wherever you worked all those years? Not to say that those health plans through their employer or union are better options than what we have, but the last thing we would want to do as agents is take away an opportunity for subsidized health care that somebody earned as a retiree. A couple of resources here. I'm not going to open them up right now, but there is a Medicare enrollment period page. We did a Medicare enrollment period training, and that link will take you directly to Medicare.gov, where you can see the different enrollment periods. Also on TLC Agent Hub, we do have an enrollment period resource that we have posted for agents. It was actually created by United Healthcare, but it gives great scenario-based information to help you navigate these enrollment periods. Before we meet, we want to make sure, unless we're just doing an initial meeting to educate that client about the Medicare process, maybe a Medicare 101, maybe they're not going to age in for 8 to 12 months. But if they're really pressing us to do a Medicare enrollment, we want to make sure that they actually have a valid enrollment period. So check out that page or go back and check out our training on enrollment periods. We also have a link here to a basic client management form that we have here at TLC. I know we do almost everything online, but this is a really great form to have a paper copy of the basic demographics for your client. You can record their information, and you can also write down what plan you placed them in. It's good to have that hard copy, especially during the annual enrollment period where you're working so quickly and you have so many meetings back to back. That client management form gives you that that piece of paper that you can go back and check on later that all these enrollments that you did the application get approved? Was everything submitted the way that you intended it to be? So we do recommend that you fill that out for your client interactions. A great resource, very easy, only takes a few minutes to do in your meeting. So sometimes you're going to get a client who comes to you and maybe they're 3 or 4 or 5 months out from their 65th birthday and they do not have Part Medicare A and B active yet. The key here is knowing their circumstance. So if the client is already getting benefits, retirement benefits that is, from Social Security or the Railroad Retirement Board at least 4 months before they turn 65, they will automatically be signed up for Medicare A and B effective on the first of the month of their 65th birthday. Since Part B has a premium, they will be given the option to defer Part B if they have a creditable health plan through their employer or a spouse that meets their needs. Some clients will also choose to defer Part A, even though it is premium free. And one of the reasons that they may consider doing that is maybe they want to continue to contribute to an HSA, a health savings account. You can dig into this a little bit more. We'll do some more trainings on this. But generally speaking, if you're contributing to an HSA and you're working past age 65, you want to stop contributing to that HSA 6 months prior to applying for Medicare A and B. So this isn't what this session's about, but make sure if you don't know, you look into how do HSAs work with Medicare Part A and Part B. So the last piece here, employers must provide an annual notice about whether their plans meet the creditable guidelines. If you're having a conversation with a client who's trying to decide between their employer health plan and a Medicare Part A and B enrollment with one of the plans that we can represent, yes, we want to do a plan comparison. We want to look at their employer offer, whether it's a retirement plan or they're going to continue to work into their mid-60s. How does that plan compare to what we can provide them through the Medicare pathways? And then also, we want to make sure that the plan they have through their employer meets creditable guidelines. Like I said, they're going to get that annual notice. Many of them often don't really pay attention to that. So in these retirement planning meetings, we may have to prompt them to reach out to their employer's HR team and just verify that that plan meets the creditable guidelines. If it doesn't meet the creditable guidelines and they stay on that plan past age 65, it is very likely that they will incur late enrollment penalties for both Part B and Part D if and when they join Medicare and choose a plan. In this case, the client comes to you, it's 7-8 months out, and we're talking about Part A and Part B. We can give them some guidance on how to sign up for Medicare A and B if that's the path they're going to take. If they're within 3 months of their 65th birthday, we can help them, but I would recommend that you go through some training before you actually help them fill out an A and B application online. This is good information that we can share with the client if they still have to enroll actively in Medicare Part A and Part B. One way they can apply for A and B, again, if they're not already getting those Social Security retirement benefits 4 months before turning 65, they must actively apply. They can do so online, create a Social Security account. This is really the easiest, fastest way for them to sign up in most cases. We can help them with that, but the one caveat is if they're in your office and they've already created an account and they do not know their login information, that can sure take up a lot of time in your meeting. So we got to be careful about getting into that, but they can easily go on their own, create a new account or log into their account and quickly sign up for healthcare benefits on the Social Security website. They can also set up an appointment by phone. They can call the national hotline here for Medicare and go ahead and get that enrollment taking place. They can also sign up by phone. Here's the number that they would call to get that appointment scheduled. Some of our clients will still go to the local office. I feel like, through the COVID years, that became a little bit difficult, but we do have clients now that have returned to scheduling that opportunity to go sit down with a representative at their local Social Security office to go ahead and complete their enrollment for Part A and Part B. In a perfect world, they get their A and B card 2 to 3 weeks after they sign up. They should get that welcome package, including that red, white, and blue official Medicare ID card. This does vary a lot of times by county. I hate to say it, but it's just true. The strength of the county office, how efficient they are, how well staffed they are, can greatly affect the timeline in getting the Part A and B effective. One last note here. Again, this is not the focus of today's session, but if you're talking to a client who has to apply for Part B only, there are some forms that they have to fill out to do that, and we have some resources for you on that if should you need them. But when you apply for Part B only, you're filling out a Part B application. It's a little bit different than when you're applying for turning 65 eligibility. In the notes section, if you're helping someone apply for Part B only, on that Part B application, make sure to indicate strongly when that individual wants Part B to be effective. With that, we're going to segue to our Smart Enroll demonstration. Today's session, we're looking at things that we do prior to the enrollment meeting. And so we're going to do an example of how to walk a client through that scope of appointment process and also how to create a client profile here in Smart Enroll. So we're going to navigate up here to the new profile area. Go ahead and click on it. And we're going to choose new beneficiary. And while we're here, Smart Enroll only requires you to enter initially to create a profile zip code, first name, and last name. For our purposes, we are going to enter an email address. We're going to enter a phone number. And then we're going to enter an address. And the reason I want to enter all that demographic information is when my client gets the scope of appointment form, if I don't type in their basic demographic information, they're going to have to do that on their end. And my goal here is to make this process as easy for them so that they really feel like we're taking good care of them, because that is our true goal. I'm going to scroll down here and click Save. And then down here at the bottom, we're going to go ahead and click Continue to Scope of Appointment. So now that I'm on the Scope of Appointment page, I have several options. Option 1 is to email my client the scope of appointment. So I go ahead and click Email Scope of Appointment. It's going to pop up and give me the opportunity to create a task for myself with a reminder I can add to this note if I choose to. And it's just giving me that note on my dashboard, and I'll show you that in a minute, to come back later and check on this scope of appointment status. So with that button click, I have emailed that scope of appointment form to my client. I can also text message that scope of appointment to my client by clicking the text scope of appointment. And we'll go ahead and X that out without adding a task. I can also click here to complete a scope of appointment form by phone if I so choose. Now, this does have to be recorded. So if you do not have a phone recording option, you can click Start Call Recording right here in Smart Enroll. Just let your client know this is going to generate a call from phone number for me. And you may want to let them know that the calls have to be recorded due to federal regulations. Here is the phone number that the call is going to come from. And then we can go ahead and click Call, and Smart Enroll will do the recording for me. On the phone, we have a form here that we need to go over with them. There are instructional text statements here that we have to read. There are check boxes that we have to complete, and then we can go ahead and submit that scope of appointment form. That's generally not one that I frequently use. I prefer the text or email, one less recorded interaction with the client. Plus, I just am a traditionalist, and I like having the signed standard form. I want to show you the email that a client receives. And I think this is really helpful because I always send this to myself when I first got started so that I could learn how to navigate this process and walk my client through it, they're going to get an email that looks just like this. And they're going to be able to see an invitation from me to go ahead and complete their scope of appointment form. I'll go ahead and click on complete scope of appointment form. Once they click on that link, it will open a window that looks just like this. On here, they're going to have a little video that they can watch, and then they're going to have their scope of appointment agreement to complete. They will check the products that they want to talk about. Most of our clients check all of them. We do want to make sure that we know what they're going to check, because we, as the agent, will have to sign this form and be able to indicate the same products. You may get asked by them as they're completing this, and I like to walk them through this over the phone. So we're scheduling the meeting. Let me go ahead and send you the scope of appointment link. Put me on speaker, open it up on your phone, and let's complete it together. Many of them will ask you about the authorized representative statement. The majority of the time, the answer here will be no. The only time that would be yes is if you were actually working with someone who was a scope of appointment, or the only time it would be yes is if you were actually working with someone who was responsible for someone else. They have power of attorney, they're a caregiver, and they have that legal documentation in the event that it's requested. Let's go ahead and click the checkbox. So this is the agreement box. It's a statement of understanding that the client will fill out. And then they also now have to sign their name. And then they submit the form. And they're going to get a little splash screen that looks like this. It's going to give them some of the things that we're going to discuss in the meeting based on what we checked on the form, and another reminder of some of the things that they need to bring to the meeting. Now, back in Smart Enroll, if I click refresh, I will now have the option to complete that form right here. And when I click on it, it is going to allow me as the agent to enter in my information. It's going to allow me to enter in the method of contact. So maybe this was a referral. If the form was not completed 48 hours in advance, there is a section here where we would note maybe this client was a walk-in. Then I also have to check the products to discuss based on my conversation with the client. The date the appointment would be completed. So we can fill this out ahead of the meeting. We can fill this out on the day of the meeting, just before we get into plan information. Go ahead and click the calendar. And then we can check this box and we can click submit the form. It's not a difficult process. And if you walk your client through it, it goes much easier, because even though it's not a hard form, they've never seen it before. They're already nervous about transitioning into Medicare. They're already confused about their Medicare plan options. That's why they're coming to you. We like to try to make it easy for them. Now that we've completed that, I now have the ability to talk to my client about those specific products for up to 12 months without completing a different scope of appointment form. Now, if they only checked Medicare Advantage plans and then they want to talk about Medicare Part D plans, we have to fill out a new scope of appointment form. You can see here, it tells me right in their profile what products they've agreed to talk to me about on that specific form. It also tells me the completed date of that agreement between me and them, because that's really what a scope of appointment form is. It is an agreement between me as an agent and the client about the products that we're going to talk about in our meeting. Again, scope of appointment. It's setting the expectations in advance for what we're going to discuss. Smart Enroll will maintain that for me for the required number of years. I can also view that document by clicking view. If I need to, I can print a consumer form, a paper version of that scope of appointment form. I can print it right in Smart Enroll by clicking right here, and then I can upload the completed version of that form. I click upload, I go ahead and select a document, and then I can have that in my client's profile for the required compliant amount of time. The only other thing you may do prior to the meeting, we're not going to spend time on this, and this is going to come more in session 2, but if you click add preferences at the bottom of your screen, you could technically add their preferred providers, their preferred pharmacies, and their preferred prescriptions. in their profile ahead of your enrollment meeting. Come back for part 2, where we'll get into some of the specific presentation approaches that we use in our meetings with clients as we help them decipher their Medicare insurance plan options.